Welcome to the Wellness on Tap podcast with your host, Dr. Debs Eastwood.
So today, I'm sitting opposite the glorious Michelle Rowlinson, who has travelled up here to be with me to share her insights, her pearls of wisdom about menopause and the surrounding areas. I'm not going to say too much now. I'm going to let Michelle allude to all of that. So welcome, my darling. It's a delight to have you here.
It's a delight to be here. Thank you for asking me.
So can we start right back at the beginning then? Obviously, two girls together here.
Yep.
Menopause is very relevant to us, and I'm not saying it's not relevant to the men. I think a lot of them experience, side symptoms, shall I call them, from the menopause, and maybe there is even a menopause, something.
There is a version of it, but not quite as severe as ours, or as ours can be.
Yes. So is that the reason you got into it, just because you were a lady and knew it was going to happen to you at some point, or was there some other reason?
No, it's through personal experience. And I often get, oh, you're too young, you couldn't have gone through this. And this is where there's so many myths and misconceptions, even from our doctors, which is the crazy part. No, I was 32 and I just suddenly, out of nowhere, just started getting all these symptoms. I think the first one really, or the first noticeable one, was the weight gain. I was slim and I was eating healthily, going to the gym, and all of a sudden it just started piling on, particularly around my middle, and it was fast. And I just didn't understand what was going on. I then ended up gunning it in the gym 6 days a week, which I now know is the opposite of what you should do. So I'm sort of talk about that later. And I ended up putting on 20 kilos in weight within about a year and a half. My son's friend's mum thought I was pregnant because it just went all around my middle. So that was that wasn't exactly nice. I suddenly had acne, worse than when I was a teenager. My hair was falling out. And dry skin. But it was the brain fog and the memory loss. So I'm a physio by trade, and I would literally be in my clinic, and I would get to the waiting room and I couldn't remember my patient's name. And I literally thought I had onset dementia.
Wow.
That was the bit that was starting to scare me. But I think that the most crippling one was the anxiety. And I'd gone from a really confident, strong woman, and I literally write about it in my book, where I was just being told by the doctor that I was stressed, I was depressed, have some antidepressants, which is their usual go-to, have some antidepressants, even though they only help clinical depression, not hormonal depression. And I was suddenly getting car anxiety, which I've now found is a symptom. So many women, like on my TikTok, go, oh my God, I didn't understand why I've suddenly got scared of roundabouts or motorways.
Really?
My one was hill starts. So I've never rolled back in my life. I've had excellent clutch control. And all of a sudden one day I was parallel parking on a hill, and my legs went completely to jelly. I was blocking the road, so I eventually managed to sort of pull it together and get in the space. And then I was like, I can't, what if I roll in the car behind? Oh my God. So, and I literally nearly had to ring my other half. It was only pride. I was like, I'll never live it down. So I went for a walk, and then and even now I will avoid parking on a hill. And I will avoid routes if I know that there's like a roundabout on a hill. It's weird.
Wow.
And I even ended up, because I've also got something called endometriosis, and it affects my left leg. So I got an automatic, but now I'm more scared with the automatic because I've got no control if it rolls back. So it's crazy.
Oh my goodness.
So yeah, so that's what, and I then had a massive panic attack in a supermarket over whether I was going to get the wrong cereal. And I literally had to, it's laughable. It's not spilt milk, it's cereal. I literally had to leave my shopping. I ran out the shop. I sat in the car. My heart was pounding, tears rolling down my face. could barely breathe. And I was like, this is not normal. And that was what then led to me researching, because I thought, I've got something serious. It's got to be a brain thing. And then I found out about the word perimenopause. And I was like, oh my God, that's what I've got. I'm not going to die. It's not progressive. And even that was just a weight off my shoulders. I've now found that the British Menopause Society have found a third of women are like me, where they haven't heard of perimenopause before they start having symptoms, even now in today's society.
And we all think that we're all knowing, don't we?
Yeah.
You know, Dr. Google.
Yep. And I just thought we went through menopause in our 50s, 60s. It's like mood swings, no periods, hot flushes. And I thought that was it. Boy, was I wrong. We can have over 100 symptoms because estrogen receptors are in virtually and testosterone receptors are in virtually everything.
Yeah, that is very true. And you're right, that is the typical explanation of menopause, isn't it?
Yeah.
Hot flushes, mood swings, and your periods stopping. And I would imagine most people are aware of that.
Mm.
But your mission then, I guess, is linked with enlightening people.
It's education. So I don't really call myself a menopause coach. I call myself a menopause educator, because the more I went down this rabbit hole, because I then realised, again, through my own experiences, that anti-inflammatory diets can massively reduce symptoms. So, and then I realised it was a thing, because I'd put myself on it for my endometriosis, and I realised all my symptoms, my hair stopped falling out, my skin cleared up, the weight just fell off. And I realised it's a thing, but we're not told. So that led to me writing my book, because I also found that if you Google the recipes, they're all American or expensive Amazon ingredients, or with ingredients that have got names that you can't pronounce. And I love to cook, and if it was putting me off cooking, it's going to put off, people that don't like cooking. So I did my book that's got recipes, all that you can get from this in our UK supermarkets. But then women started asking me for advice. So I was like, oh, I better get qualified in this. So that's when I became a menopause wellbeing practitioner. But then I realised 1 in 4 women lose or leave their job, which is what I did as a physio. I didn't feel good enough. I was, a senior physio. I was a first contact practitioner, which is a bit like a GP, where in surgeries, if you call up saying you've got foot pain, arm pain, you'll get one of us. And I just didn't feel good enough. And I literally was like, I can't cope with this. So that was when I left. So then that led to me wanting to do workshops for businesses to educate businesses so they stop spending a fortune on absenteeism, even presenteeism, because women are not, they're making mistakes because they're not being able to do the things that they, like the multitasking that they used to do. But I think my biggest light bulb moment was, even as a physio, I realised doctors aren't trained in it. They get less than an hour's training in menopause. And I was like, oh my God. And then I was like looking through because it was 7 years of hell before I actually had this epiphany.
I was going to ask you how long it was
7
before.
years that I went through feeling like there was something wrong with me. Not saying he was meant for me, but I'm convinced that the breakdown of my marriage, not, as I say, saying that we were meant for each other, but it didn't help that we got married the year that my perimenopause started. And he probably thought, oh my God, what have I married? With the mood swings and the rage as well. I mean, it's funny when you talk about rage, it's like you've got this voice in the back of your head that's going, you're out of order, but you can't stop. You consciously know that you're a screaming banshee, but you just can't stop yourself. So that led, because in my journey, I was seeing a cardiologist for my heart palpitations, not one mention of hormones, just, you can have beta blockers, which thank God I was like, well, will I die without them? No. Well, then I won't take them. As long as I'm not going to die, my dentist, I went privately because I nearly lost teeth. And all I got was a lecture on oral hygiene. And I was like, I think that might have been the first thing I would have addressed before spending all this money on you. And then by this point, I'd already written the book, but I went to my optician for dry eyes that I knew was peri, but my mum's got glaucoma. And as I would tell anybody, always get things checked. Don't just assume. And when it was, she said, oh, it's dry eye. And I was like, oh, so it's peri then. And she was like, peri what? And not only did she realise that, yes, I get lots of 45 plus women coming with dry eyes, she realised she was perimenopausal and bought my book.
Oh,
but that's when
full circle.
Yeah, but that's when I got oh my God, all health professionals need to be trained in menopause. As a physio, I knew that women 40 plus were more predisposed to frozen shoulder, tendinopathies, joint pain, plantar fasciitis. But no mention of hormones. And I did a women's health placement as a student. Not one mention of it. Was just, prolapses and, and abdominals and things like that, but no mention of hormones.
You're just blowing my mind here. This is, because obviously I've been through medical school. I know my experience of being taught women's health was a women's health block, like we had a neuroscience block, we had a nervous system block, we had a respiratory system block. It was all sort of divided into body systems. And I don't actually remember anything specific on menopause. I'm not saying it wasn't covered, but I don't remember it. That's how intensive and comprehensive it was. Yeah. Sorry, Sheffield Medical School, but
Yeah. Well, that's the same as a physio when we were doing the women's health bit. Not one mention of menopause. And I remember looking back, women coming to me. Now, what I was doing to help their tennis elbow, their plantar fasciitis, things like that, it was helping the symptoms. But I remember them distinctively saying, I'm falling apart. And I look back going, oh my God, I bet she was menopausal.
Yeah.
Because she was, the ones I'm thinking of were all roughly the right age. But what was interesting, so last year I taught trainee GPs at Norwich, and I'm very, very excited they've asked me to come back next year. And I was trying to think of a way, because I was really nervous, as you do, sort of imposter syndrome. Oh God, they're actually qualified doctors, So I decided to start it. And I hope none of the new ones are going to hear this, but because I'm going to do the same. But instead of introducing myself, I did a case study. And I said, right, I know we're here for menopause, but I want you to discuss amongst yourselves what you would be thinking, what you would be testing for with these symptoms, with a woman who's 35 years old, who'd been experiencing these symptoms for 3 years. And so I did it in a medical way. And then when we came back, and it was like, so what are your thoughts? And one of the female ones, she was like, I know we're here for menopause, so I know that that's going to be menopause. She went, but 35 years old would not be on my radar. I wouldn't even be thinking of it. And I was like, exactly. And I'm going to be honest, that's not Sarah. That's me.
Yeah.
I went, and every doctor I saw told me I was depressed. And actually I was perimenopausal. And I said, because most doctors haven't heard of perimenopause either. They only think of menopause. I had a lady only 2 days ago on my TikTok saying, I've been told I'm too young. What's the age? I can relate to all these symptoms, because I often do just a video either pointing or acting out sort of symptoms. And I was like, well, how old are you and what country? Oh, I'm 45 and I'm in the UK. I was like, well, for a start, nice guidelines state that you can go just by symptoms for HRT. So your doctor clearly, if they're telling you you're too young, clearly has no idea about perimenopause, and they're thinking of the average age of menopause, but it can still happen at any age.
Absolutely.
So there is no such thing as too young or too old. I've had a lady say, I'm 60. Why am I not going through menopause? It's like, because your body's not ready yet. It's,
and that's the unusual end of the spectrum, isn't it? Am I right in thinking that the age is still around 51, the average age for menopause?
51's the average age for menopause.
Yeah.
But perimenopause can last anywhere from a year to 15 years. So
that is really
So it makes sense
scary.
that 30s are mid to late 30s are more common than you think.
And I mean, a typical, if we can say there is such a thing, a typical woman's life, apologies for those that are in any way atypical, I'm going to upset you all, apologies. But a typical woman, heterosexual woman, would be married, having children, working, just thinking that maybe symptoms that she's getting that could well be perimenopause are because her body's changing. She's having kids. She's working hard. She's doing things now that are proper adulting things that maybe just 5 years before she was still out on the town and having a good time, maybe meeting the husband that she now has. Yes, that's very typified. But that sort of woman probably wouldn't think I'm perimenopausal like we all do. They'd attribute it to everything else but
stress. And, you know, we do live much more stressful lives. And that actually adds to the hormones because your body will prioritize your stress hormones over your sex hormones. And the body doesn't know the difference between real stress and perceived stress. So you think, and this is what was happening to me. So I had a very stressful job, as you'll know, in the NHS. It's not, and again, it was during COVID, so, you know, some of it, so it was not easy. I had stress at home with my autistic son being a teenager. Any teenager with hormones is stressful, yes. But throw a little bit of autism in there. And then I was gunning it in the gym, raising my cortisol. So my cortisol was just up here constantly. So it was no wonder that my body was like going, you know, try and calm.
Yeah, that much cortisol is not good for you in any way, shape or form, is it?
And that was prolonged for a good few years. I just didn't really have any downtime. So again, that kind of exacerbated everything. But yeah, and, you know, and I think, and this is why it does attribute, you know, the average age for marriage breakups is in women's 40s. I don't think that's you know, I've had many men come up to me when I've done my workshops at businesses. And it's great when I get the men come up to me, or even just joining in, because my workshops, I don't just go, this is menopause, we do 3 stages, and it's very interactive. I go into mindset, so it's very relevant for men to join in anyway. Diet, lifestyle, nutrition, things like that. So it's very informative for everybody. But I love it when I get the men going, oh, that explains a lot. I think that was what was going on with my wife. And obviously I always say, I don't know what your relationship is like. I can't make a comment.
Yeah.
But I do think there's 2 reasons why relationships break up typically in the 40s, because one, we can just, again, with the symptoms, rage things, so it can affect the relationships in that way. But also, it's almost like our brain like recalibrates and we become stronger. And I think a lot of women also won't put up with stuff that they used to. So I think there's 2 reasons. There's a positive reason, and then there's the upsetting, you know, negative reason for the breakup. So it's not always a bad thing, but I think that's why I always say, I don't know what your relationship was like.
Yeah, of course. Yeah. You've got to cover your back, haven't you? Yeah. God, there's so much to unpick there. One thing I'd like to unpick that you mentioned a few minutes ago is food and anti-inflammatory stuff. And a bizarre thought just popped into my head as well, something that I saw on the wonder of social media just recently. I've seen it a few times actually, where they're saying that Japanese women don't experience menopause, if at all, certainly not in the same way as we do over here in the West. Is that to do with their diet? Is there a link there? And lifestyle. So
they typically eat a lot more plant-based. So you can get natural estrogen called phytoestrogens in food like soya, tofu, things like that. So their diet for definite, it's more fresh. Obviously, we're talking about ones with their natural kind of food, not the ones that are like, still getting fast food and things. But so yes, they eat a lot more fresh food, a lot more plant-based food, oily fish, because omegas, again, that's an anti-inflammatory in itself. So eating oily fish, but they're also more active. So we typically now, us Westerners, we're just sat on our bums with a laptop or a computer. We're not as active, whereas I know it's being a bit stereotypical, but they're in fields, they're doing things, they're active, they walk to places, there's sort of public transport. So that's what I mean by in their natural sort of environment, as opposed to the big cities where they're sort of not quite the same. But yeah, so they're more active, they're calmer, their lifestyle isn't as chaotic, they're not as stressed. So there's a lot of reasons why, this obviously my opinion, why they typically don't really get much of a menopause symptom.
So there's a lot to learn, isn't there?
But again, I get asked, well, why are we suddenly talking about it? We've always gone through menopause. Well, we have. But again, our lifestyles have changed massively over the 50 years. Our diet is not as good. We're not as active and everything. We've got that side of it. But also, people need to remember that we did go through menopause, and women often were put in asylums if they had bad symptoms for being demented, basically.
Hysterical.
Yeah.
That was the word, wasn't it?
So, or they thought, they were having like dementia type symptoms or things. They were put in asylums. And someone, it was only a few weeks ago, said something to me, and it made me think when they were like, do you think women were burnt as witches? Oh. And I was like, oh.
Wow.
Oh, maybe they were menopausal and acting crazy.
Maybe.
Yeah. So
went to York Dungeon with the kids. It's an interactive experience. This was 10 or 15 years ago when they were little. And they were picking people out of the audience to do various things on their interactive sort of stages as you move through the different rooms. I was picked out to be burnt to the stake.
I think I would have been as well.
I've always thought that was quite a telling lesson there.
Yeah.
So, but anyway, I distract you. So
no.
It's interesting though, isn't it, to think that, and I mean, going back even further than that, when we didn't live until our 70s and 80s.
That's the other thing, is that we typically would get menopause a bit later. We're starting our periods much younger than what we used to, and the whole point of the menopause is when we've depleted all our eggs and we're born with our eggs, and we start depleting our eggs from our first period. So it stands to reason if the average age of periods was, age 15 or 16, even 20 years ago, and now children are having, girls are starting their periods as young as 9, some of them.
Which is,
and I was early, I was like 11. So it stands to reason why mine was, a bit earlier in my early 30s. But yeah, so we were, we were having our menopause later, but we were also dying massively earlier in our, late 50s, 60s. So if anything, it was just our last couple of years that we'd be experiencing it. Whereas now we can go, 30 years, even, 40 years, we're having women living to 100. So, and this is why now it's a really important time for research with HRT and stop scaring women with HRT. Those trials have been proven that, the results were leaked before they'd even finalised the results, to say, it causes cancer. And actually they've now studies started showing that body identical HRT can even reduce the risks of cancer, and reduce the risks of osteoporosis, cardiovascular disease, and studies are even showing dementia, because we're finally doing, studies on it.
Yeah.
But, and even the old-fashioned synthetic oral one, it's very minimal risk if you compare it to diet and lifestyle. I can't remember where I got these, so don't quote me, but I think it was something like 1.9 increased risk of cancer with the oral ones compared to 2.9 of bad lifestyle with alcohol, smoking, obesity. Alcohol and obesity are, big ones for increased risk. And 1 in 7 of us over the age of 60 are likely to experience breast cancer. So again, it's kind of like, just because you've taken HRT doesn't mean that's the reason. You've got to weigh up it's a very individual you weigh up the pros and cons, the risks versus benefits to you individually, not a blanket, oh, you can't have that because of such and such. And also a lot of doctors, because they're going by the old synthetic, I find that they're telling ladies who are diabetic, oh, you can't have HRT because you're diabetic. It's like, no, that's the oral one. They can still have transdermal. Or, oh, you've got a history of blood pressure, or you're obese. I had one lady that was told, you're far too obese to have HRT. Go and lose some weight and then we can think about it. And it's like, it's the oral one that has the increased risks of blood clots. And this is still a very small risk. But again, they're not thinking of the body identical transdermal ones, which the majority can take. There's a small minority that, and again, it's all very individual.
Absolutely. Yeah, everybody's journey is different, isn't it? I mean, for me as a person, a few years ago, the kids, bless the cotton socks, we made it into a bit of a joke. I'd be going in, just doing the normal shopping in Tesco's or wherever other supermarket. And they'd say to me as we went into the shop, do we need an extra trolley today, Mum, for all the layers you're going to strip off while we're walking around here? And I didn't suffer anywhere near as much as a lot of my colleagues at work. In terms of the hot flushes, which were obviously the reason for me peeling off, not anything else, in case that's what anybody was thinking. So, yeah, things are very real, aren't they?
And it's important to be aware that you don't necessarily get hot flushes.
No.
Again, I've had women told by their GP, if you're not having hot flushes, you're not in the menopause.
What?
And it's like, I didn't get hot flushes. I only got hot flushes when I was having treatment for the endometriosis, and they gave me Zoladex injections that are not pleasant. And that for some reason gave me hot. And I remember I started taking it, I thought I had a temperature. And I was like, oh, this is what hot flushes feel like. Oh, okay. I actually had the opposite. I had chills.
Oh, okay.
So I was the opposite.
Interesting.
And even now, and it's not a symptom that I've Googled and it doesn't come up. And I'd love, and I keep meaning to do need to do a TikTok on it. I get almost like a feeling of frostburn on my face. It's my nose and my cheeks, and it's more when I'm stressed. And I literally, it feels like I've just been blasted with cold air and I've got frostburn. That's the only way to describe it.
And that's not associated typically at all, is it?
No.
So we've got a typical sort of triad of symptoms for menopause, if you look at old school definitions. Are there any symptoms that are more typical in perimenopause that women should be looking out for?
The ones definitely that I find I get most reaction to on my TikTok is itchy ear. That one went viral. Oh my God, I've got that. I keep being told there's nothing wrong with me. It's because it affects the lubrication in the ear, so the tissue gets sort of dry. Typically, it's always one ear as well, which is weird. Like a burning mouth, metallic taste in the mouth. I got the metallic taste one. Definitely, obviously, always get these checked because they can be other things. What other ones? Like itchy, crawly, like you've got insects under your skin. That's
How
quite
pleasant.
I know. Insomnia. That was one that was, and it's not a typical you can't get to sleep insomnia. It's a wake up at 2 or 3 a.m. and you will not get back to sleep for love nor money. And you're like, oh no, here we go again. And it is typical. It seems to be more typical that it's a waking up one, not a going to. So that's why medications don't help. That was something I found when I could finally take HRT. The Eutrogestin, the body identical progesterone, God, I sleep better since having that. And I know when I've forgotten it, because I'll wake up again at 3, 4 in the, or if I'm not sticking to my own advice and being on anti-inflammatory diets, it's the insomnia that comes back first. That's always been my main one. Taste buds changing. So things you used to like, you don't like anymore. I had one lady, she was like, I don't like wine anymore and I'm not happy. It's like, it's healthier. But she was like, I liked my wine. It's like, okay. So it can be even bizarre things like your taste buds changing. Obviously there's anxiety, low mood, being emotional, brain fog. Brain fog is definitely, you just cannot focus for love nor money. And this is why often, and again, in the workplace, when I say 1 in 4 women lose or leave their job, or they downgrade where they just don't feel they can cope with the stress of being at the top, this is why we're losing some really spectacular women in really top positions. And this is why it's so important. It's education. And when I'm sort of speaking to people and they're like, oh, so really it's just educated? It's education. We should be taught it in schools. Why are we not taught it in schools? I mean, we got taught the most ridiculous stuff.
Yeah,
I remember being taught about a Femidon. Who's ever used one of them? It's like, why?
Yeah.
Rather than being taught, this is what all women are going to go through. The boys need to be taught it, because even if they're gay, their mums, their sisters, their aunts, their cousins, their friends, their colleagues, everyone is directly or indirectly, involved.
Yeah.
So it's such an important thing. And again, why my passion and my mission to get into female prisons, because I can't think of anything worse than hormonal women locked up in confined spaces. But also, how many of them are there, and I'm not condoning anything, but how many of them are there for doing something that was out of character due to hormones?
That's a really interesting thought.
And I feel quite passionate about, there are times, when you just snap because things irritate you, like noises or my partner breathing. Shut up, stop breathing, or eating, the sound of eat. I mean, that was one of mine. Please stop chewing. Please just stop chewing. And it sounds crazy, and again, like I said, I'm not condoning or anything like that, but how many of them are there for something that was out of character?
Gosh, and I bet there's no research on that, is there?
No.
Might be quite difficult to do.
And again, it's like I got asked when I was doing a work one. Well, what do we do about women that are going to milk it, and play on it? Well, you're going to get that in any, you're going to get that with mental health. You're going to get, so, it's about just each individual case, but yeah, it's a mind blow. With the more, and this is what's happened with me, the more I go down the rabbit hole, the more I'm like, oh, well, what about this? Well, what about this? And then I'm like,
it's kicking off more questions while you're finding answers too along the way.
I was in Brixton prison last month delivering staff training, because obviously it's a male prison. Because you imagine if you're, and I get, when I did a wellbeing, it was only a stall, it wasn't a workshop at Wayland prison in Norwich. And a lot of the women were saying, yeah, we've got these big belts and this and the uniform. But if you're, you can't just say, oh, I need the toilet, because again, we don't realise that our periods don't just get lighter and less often. They can come heavier and more often and irregular. So you don't even know when it's going to happen. And I've known quite a few women where they can't leave the house because it just goes through the pads and the clothes, in the first few days. So again, it's sort of trying to make the prisons aware that, women are struggling, because actually a lot of these prisons are 50% women for the staff.
Of course. It's very real, isn't it? It's a very real issue.
So, you know, it's really important in any business to be aware of it, but particularly ones where, you know, okay, you can't do the flexi working, you know, there's certain things. So when I'm sort of talking in my workshop saying, you know, if you've got an admin day, do you really have to go in? Can you do you know, and also prioritize when you know you know, we have certain times of the month where we're more productive. So the more mentally challenging things do on your productive times of the month, and the more easy stuff do when you think you're going to get your brain fog and things. So it's very much, you know, time management, and being able to have that chat with your boss of saying, okay, I can do my job, and I'm not asking for, you know, anything special. I just want to say, you know, can we do these sort of things on these, you know, and or just having a, you know, a general
having somebody
chat.
who is educated and is therefore able to have those conversations, because conversation is a two-way thing, isn't it?
Exactly. And hopefully after today, many people are going to be, oh, yeah, okay.
I do hope so, because I think your mission's wonderful. And what you're doing should be massively accessible. It should be out there for everybody. And there was one thing in as well that you touched on that, you know, I think a lot of people need to know more about. And that was where you were talking about going down the gym was completely the wrong thing to do because of all the cortisol to help with the weight gain.
Well,
what can women do?
So not necessarily going down the gym was the wrong thing. It was what I was doing in the gym.
Okay, fair
so
enough.
I was gunning it on the stepper for like an hour. I mean, I look back, God, I wasted my life. I was like, it's bad enough doing it, let alone to have no benefit from it. But I literally, I was like on the stepper for like an hour. Then I'd be on the rower for like 20 minutes. And then I was like on the cross trainer for like another half an hour. So I was just doing all this cardio thinking, yep, let's burn this fat, let's burn this fat. And all this. No, what I should have been doing was low to moderate and more weight resistance, big for your bone, things like that. So you want to be, it's low to moderate. So swimming, Pilates, yoga, weight training, kettlebells, things like that, rather than just literally, you know, don't get me wrong. If you're somebody that has up until now been an absolute gym bunny in those spin classes, running marathons, your body's used to it. It's not going to treat it as something, not horrible, but it's not going to treat it like the same way as if someone that's not used to it suddenly. And I was a gym goer, but I'd literally ramped it.
He's ramped it sky high.
Yeah.
Yeah, okay. So it was that change that was wrong then.
Yeah. Yeah, what I should have been doing was more swimming. And I always say things like aquafit because it's also a giggle.
Yeah.
You know, it raises your, all your happy hormones instead of your stress hormones. And equally with aquafit, they use floats for weights. So you're doing your resistance.
And that's hard work, isn't it?
Yeah.
That can be, and you can go a bit shallower and make it less challenging if you need to.
But because you're having a giggle when a float pops up and, and things like that. But I think we associate aquafit with being old ladies because that's what they generally used to do because it's a really good thing that all ages can do. But actually, there are aquafit classes that are more for sort of, any age do it, I must admit, is probably more 40 plus, but there's no reason maybe there's some, I used to be a swimming teacher, but I'm not going to go down that route again, but hopefully there's some swimming teachers listening or aquafit teachers going, actually, there's a niche here.
Yeah. A massively untapped market.
Yeah.
Yes, all you entrepreneurs out there, get on it, basically.
Yeah.
So when you were talking about strengthening exercises and weightlifting, that's massively important for bone density, isn't it? Which, as you get older, I'm an anaesthetist in the NHS by trade, I see an awful lot of little old dears, male or female, coming in with fractured hips from falls is the worst one, but fractured all sorts. Injuries that perhaps wouldn't have caused a fracture.
And we lose muscle.
Yeah. And like grip strength is so important.
Yeah.
You know, if you're falling, you can stop yourself if you can physically grip, keeping control of your balance and your bones being more resistant to fracture. If you've built up on them. We typically get prescribed, you know, if we go to our GPs for that, you know, to take some calcium and vitamin D. What else is there out there that can help with bone density?
I mean, definitely sort of looking at your vitamin levels, making sure, I mean, we're all vitamin D deficient, especially in the UK. We don't really get sun, even in the summer. So I always recommend, you know, some of them I wouldn't say everybody should take because we're all individual, but vitamin D is one that we all should be taking really. But, you know, it is more sort of our diet and lifestyle for definite. We do lose muscle. So things like collagen as well for our skin that we stop producing. There are some really good collagens out there. I always, quote me if I'm wrong, but I always say the liquid ones because our body absorbs the liquid ones. The other ones, I can't remember what the percentage was, but I think it's really low that we actually absorb with the pills and the powder type collagen. So I always say look at your collagen that's got vitamin C in it because that helps you absorb it.
Yes.
There's some out there that if they don't have vitamin C in it, make sure you are taking that with it. For sleep, magnesium glycerate, definitely. I've had many women that can't sleep and they take that. So that's another one that I often sort of recommend. Vitamin B complex.
Definitely.
It's a good one for both your mind and body. Omega-3s. I don't, and again, quote me if I'm wrong, but, you know, I don't recommend the multivitamins because they're very small amounts in them and they're often packed with fillers and all sorts of stuff. So try and research a good quality as well.
Yeah, you need to be careful, don't you?
So I'd often say, you know, it's well worth spending the consultation with a nutritionist. Because that's one thing I always say, I'm not a nutritionist, so I can't sit there and recommend what you personally, I can just say the blanket of what are good ones that I would often say look into. So what I've just quoted, iron is another one that we're often deficient in, which again, if you're feeling tired, you know, and you can ask your GP, look, can I just get all my vitamin levels checked to see if I'm deficient in anything? Because a vitamin deficiency in itself can actually mimic perimenopause symptoms. So you might not even be perimenopausal. So again, I'm not one that goes, oh, it's always perimenopause. You might just have a vitamin deficiency.
And that would be a very quick fix, wouldn't it?
Exactly. And, you know, and that they can cause skin problems, hair problems, energy levels, brain fog, you know, so that in itself. So it's always important to get everything checked first and then have that chat with your doctor. Okay, so everything's now been ruled out. Because I think, again, what I go through in my workshops are we're often misdiagnosed for things like fibromyalgia. Now, I'm definitely not saying there aren't women out there that generally have fibromyalgia, ME, chronic fatigue, 100%. However, I do think a lot of women, particularly if they're younger, like in their 30s, and the GP's not very educated on menopause, and I do think there are a lot of women that are misdiagnosed out there with it, or misdiagnosed with depression due to the fact that they're not very knowledgeable on menopause, and because they'll, well, I don't know what your symptoms are, so let's just label you with something else that doesn't have a test. Because the trouble with perimenopause is bloods are often inaccurate because our hormones fluctuate. So you get many GPs that will do a blood test. They don't even try and do it on the right time of the month. But even if you are doing it at the right time of the month for your hormones, really you should be doing one every 3 months to try and get an average. But of course, we don't do that on the NHS. We get one, often it's just a random time of the month. And then it comes back, oh, you're normal, whatever normal is, because we don't know what our normal range was in the first place. And then because our hormones can change hourly, and you're like, well, okay, which is why even though it says 45 plus, the NICE guidelines do state that you should go by symptoms if everything else has been ruled out.
Very sensible.
So, but I think because, again, they go, well, I don't know what this is. Oh, well, I know fibro has these kind of symptoms. We'll just label you with that. Or the other side of it is when your symptoms of other conditions are exacerbated due to hormones. So like thyroidism. Many women, they're fine on their medication, and then all of a sudden everything's going P-tong and the GP's just upping meds and they're going, it's not helping. And it's like, no, because that's not the problem. Or even depression, which is where antidepressants are appropriate, is that if you've got a history of depression and it's been managed, or you've got a trauma that you've kind of managed, and then it just suddenly bang comes out of nowhere again, you know, yes, you've got that history, but actually it's hormones that's exacerbating everything. So yes, that's where it's appropriate to treat with your antidepressants, but you also need to look at the other side of it.
The root cause.
Yeah. Of, again, where HRT, diet, lifestyle. And again, you know, I am a fan of body identical HRT, but I don't, you know, I never tell anybody you should go on it. It's always, again, it's your individual choice. But even if you're taking HRT, you need to have that education of, well, it's not a magic pill, it's not a magic patch, it's not a magic gel or spray, because a lot of even doctors don't realise there's a Linzetto spray out there as well, which is brilliant. I absolutely love it. That's what I take, because it dries in seconds, so you don't have to waddle around while you're waiting for your gel to dry. But yeah, you know, it's not a magic, you know, thing. You still need to be looking at your diet, at your lifestyle. And this is where when someone goes, oh, are there any, you know, is there anything good about menopause? Which is why I always end my workshops on the positives.
Please do, tell us.
I was like, definitely. I was like, for one, we start meeting more people, because we're now starting to, you know, we try new hobbies, we try new, you know, because hormones can affect the part of our brain which is like the reward center and the pleasure center. So we're not finding things that we used to find enjoyable. So we're looking for other things. So I know many women that started pottery or painting, or, you know, so we're sort of trying new things that way. But also because we're now looking at our diet and lifestyle, we're healthier. So it actually does us a favor in a way, because whereas things that we used to get away with, and this is where men need to sort of look into it as well, because, I mean, anti-inflammatory diets, they're not just menopause, they help with joints and all sorts. There's lots of other conditions, like my endometriosis pain, massively help the pain, because obviously things that are inflamed, it's helping to sort of calm it down.
Makes sense.
So, you know, I'm a big fan of it for everybody, not just women. But yeah, I think definitely that's one of the things, is that we, you know, we are now a much more healthier lifestyle, which will help for us to live longer. So, you know, there are lots of pros to it, but all it is that we just now need to think what we're doing, as opposed to getting away with the you know, big nights out and eating junk food all the time. Like, you know, I look back to my diet and lifestyle at 18 of clubbing and pizzas.
Yeah. Yes, I think we've all been there in one way or another, haven't we? So correct me if I'm wrong, but in your ideal world then, people will be educated, not just specific groups of people, but everybody through the school system.
Yeah.
Whether that be children going through school, doctors going through medical school, physios going through physio school, nurses going, and just compounding that so that it becomes something that we are aware about.
Yeah.
It's not hanging over women like this black cloud. It's part of life.
Yeah.
And we can manipulate it.
We don't have to suffer. It winds me up when I'm quite passionate about what I do, and I get really passionate and I get really upset with when I'm on TikTok, and because any comment I will answer. And I get quite upset when women are saying, I've just been told by my doctor, it's just one of them things, you need to put up with it. It's just part of getting old. And it's like, no. Particularly the sort of genital urinary symptoms are like, we don't realise that UTIs, frequent UTIs, so urine infections, can be a symptom. Incontinence, whether that's stress incontinence from coughing, sneezing, jumping, or whether that's getting to the toilet in time, that doesn't have to be a thing. Many doctors go, well, it's just part of getting old. Use Tenor Lady. Why should we be wearing Tenor Lady in our 40s and 50s when you're never, unless you've got a medical surgical reason, usually due to childbirth, that pelvic floor exercises won't help. But the majority of women, it is never too late to start pelvic floor exercises, which will help with those symptoms.
Yeah.
Equally, if you're somebody who can't or don't want to take HRT, again, most women can take the vaginal HRT. So again, if you're having symptoms of dryness down there, painful sex, UTIs, incontinence, you can still take, pessaries, creams. There's all sorts of local HRTs out there. So again, but unfortunately, I can't remember the statistics off my head now, but there is a vast majority of women out there that go up to 3 years suffering vaginal symptoms before they go to the GP.
Lack of awareness.
And that's in the UK where exactly. Embarrassment. We're not a third world country, and again, it's something ridiculous. Like 15% of women are on HRT, and even less in poor areas. And it's crazy that we've got something here that can help us, and we're either too scared, or we're not educated, or the doctor's not educated for them to take it, for them to have that option.
Yeah.
And that's what I always say, what I do, because I've been doing 8-week workshops with Age UK Norwich. So we've been providing free workshops. And I mean, I've loved it because so many of them are now on HRT, or again, the doctor said, they've tried it once. Oh, well, if it's not worked, that's it. HRT is one of the most complex things to prescribe because we're all different. We all absorb differently. There is no one fits all. Mm-hmm. Some women won't absorb well with the patch, but they'll absorb better with the spray or the gel, or actually the oral one can be better for some women. We shouldn't be afraid of the oral one because actually some women can take it and do take it, with no side effects, and they prefer a pill version. They don't like wearing, the patches. But yeah, it's being aware that. So what I do is I educate on everything that they've got there as options, so they can then make their own informed decisions. But also, I teach them how to have that conversation, even with a doctor that's not educated, important, so that they can put their decisions forward and say, look, I've read up on this. And I always say, look, if you get a doctor that says you're too young, they're not educated. So you either have that conversation or you just ask to see someone else. You are entitled to go, okay, I'll see someone else. A female GP is not necessarily better, particularly if they've gone through menopause themselves and sailed through it. They can be the worst ones because they're like, well, I don't know what your problem is. Just put up with it. So it's not necessarily better. Ask your surgery, do they have any do they have any women's health trained ones? Or, sometimes it's the nurse. Do they have any menopause trained nurses? Sometimes it's, doesn't have to be a doctor. If they don't, then journal your symptoms. so that you don't piecemeal it like I did. I went from never seeing my GP to actually not just me feeling like a hypochondriac, being made to feel like a hypochondriac. Because one time it was, going for acne, then it was my hair falling out, then it was something else, then it was something else. So in one way, it was hard for them to join the dots because it was so
disparate symptoms
all over the place. And I didn't tell them all the symptoms. So definitely journal your symptoms. Go in with some literature or have it ready on your phone, because obviously we've got smartphones now, but where it's got age ranges, that it can happen at any age, things like that. So you can say, actually, if you're telling me I'm too young, here you go.
Yeah, this peer-reviewed journal says.
Yeah, so don't be afraid. And it sometimes, and it shouldn't be, but sometimes it is those that speak the loudest, which is what I had to do with my endometriosis. It's those that speak the loudest get the treatment, which it shouldn't be.
No, I agree with that.
But unfortunately, it is, and it is with mental health as well. You have to sometimes just put your foot down and go, I'm not putting up with this anymore. So they're probably my top tips for how to get the doctor to listen.
But if you don't want to go down that route, if you want to go down
the natural route, then I would advise get your vitamin levels checked so that you know what really you need to be taking, or invest. And I use that word because you're investing in yourself.
Absolutely.
And we often don't
yes.
put us, as women, we're really guilty of looking after everybody else and not ourselves. So we often feel guilty for, taking some rest, so definitely invest in yourself and see a nutritionist if you want to go down the vitamin route. And you may even want to do that anyway if you're on HRT. Because like I said, it's the whole rounded thing.
Absolutely.
I would definitely look at your diet, a fresh diet. So with anti-inflammatory diets, Mediterranean diet is one of the easiest versions. In my book, I go into intermittent fasting, keto and Mediterranean, because also there's certain intermittent fastings that aren't good for women, but actually it can have a real powerful benefit at the same time. So it's making, do your research into intermittent fasting. And again, looking into your diet, fresh foods, whole foods, because the body recognizes how to process them. Try and reduce what's called xenoestrogens or endocrine disrupting chemicals. You can't avoid them. They're in everything, but
right.
Minimize. Try and look into more organic, natural cleaning products, because it can be in like our skincare regimes. It can be in our shampoo, our cleaning products. Also, our food that we eat, because herbicides and pesticides have an estrogenic thing. So looking into trying sort of more organic without all the herbicides, pesticides, meat that's been pumped full of hormones. So these are ways of sort of helping to sort of reduce your...
Yeah. Basically looking at ways it used to be 50 years ago.
Exactly. And this is why I say, even though, yes, we were put in asylums and things like that, we didn't suffer menopause as badly because we were much healthier.
Yeah.
So, we have got all these chemicals now in everything. And these chemicals can overload our liver, which can then affect how it detoxifies. And again, the science of it, our liver, detoxifies our estrogen. And if that's overloaded, then that's when I go into something called estrogen dominance, which can cause symptoms and can cause histamine intolerance, which is why some women suddenly end up with intolerances and allergies and things like that, their asthma suddenly is worse, things like that. And often a sign that, and even PMS and PMDD is a sign that your hormones actually are in balance. We shouldn't actually suffer with PMS. It means there's something not quite right with your hormone balance. So even if you're not perimenopausal, seeing a hormone specialist or a nutritionist
might help,
that specialises in hormones might help.
That's wonderful.
Yeah.
Wow. Thank you so much. This has been
Thank you for having
incredible.
me.
It's been fascinating. I think everybody should read your book.
Oh, bless you.
Because, and listen to this podcast, of course.
Of course.
Because it will show people, the whole population, that this is normal and there are ways to normalise it, which is what it is.
And I've made the recipes so they're simple. In fact, I had a couple of, because I do like a free support group locally to me, and we had a couple of newbies and they were looking at the recipes. And one of them was like, I don't really like cooking. She was like, these are really easy. And I was like, that's the point.
The whole point, yeah.
And I've also they're all things that I got cravings for. So sausage rolls, quiche, cheesecake, onion rings, all sorts of things. And the rest of the family, I've made it so that, you don't feel like you're on a diet. My son and my partner love it when I make the sausage rolls and the quiche and things like that. And of course they can have potatoes and whatever they want with it. So you can still do it for the whole family. You don't have to be cooking, two different meals. There's curries in there, there's stews, there's salads, there's soups, there's all sorts of stuff. So you can make it for the whole family.
Wonderful.
And also I had craving for bread. So there's a muffin that you make in literally a minute in the microwave and then you toast it. So there's something for everything. So I can have my dippy eggs, because that was the one thing. I wanted my dippy eggs.
Oh yeah, you can't go without dippy eggs.
I had to have dippy eggs.
Okay. So I want people to look for your book, which we'll put in the show notes, your TikTok, other ways that they can get in touch with you, and ways that you can get your word out there and educate.
And if they want me for workshops, so I really want to get into the, more than just get into the NHS, train when I had my hysterectomy, I had 4 nurses buy my book on a gynae ward because they were struggling with menopause and they were having no help.
And there we go.
And that was when and that was last year when I was like, my God, they're on a gynae ward and they're not getting any help.
Yeah.
So so any businesses, and please do get in contact. I love what I do. I really, really do. Because I see a difference.
Yeah.
And I love seeing the aha moments that, of, yeah. Like one lady, that's why my teeth have started falling. Oh my God, nobody's,
Wonderful.
So I love it.
And let's have many more of those. Thank you so much, my darling.
Thank you for having me.
You're welcome.